This is ICAStnews.com, live and direct from the United Nations, broadcasting out of the Security Council building here in New York. The flu epidemic, whether it's called the swine flu, whether it's called the Mexican influenza, is spreading. The United Nations organization charged with directing and coordinating public health is thinking of raising its pandemic alert levels. In New York, right now, the epicenter of the flu outbreak, the chief medical officer of the city says it's here and it's spreading. The mayor says it's here, your child may in fact get infected, but Mayor Bloomberg is counseling not panicking, stressing that it's normal for people to get the flu. The President of the United States, Barack Obama, however, has said schools in the United States with confirmed or even suspected cases should consider strongly, temporarily closing. News that a child visiting from Mexico at Disney World in Orlando may be infected have raised the specter that popular culture and broad numbers of people may yet come down with this flu. A child from Mexico visiting relatives in Houston has died in the hospital. In Europe, concern is growing. Consider this front page from the bulwark, stalwart, somewhat conservative Times of London. The swine flu here looks like the garden variety flu we see every year, Mayor Michael Bloomberg of New York said. It is very possible that this will spread further and your child will get it, but all patients we know of are recovering, with the overwhelming majority of them having only mild illness. Why then is the World Health Organization considering raising its rating of the pandemic risk from 4 to 5? The cases are going all over the world. There are suspected outbreaks in Argentina, in Israel. South Korea has reported cases. Some 149 people or more have died in Mexico. The epidemiological work, the hard scientific work of looking at just what it is about this disease, which has claimed the lives of so many people in their 20s, is still ongoing. Influenza, we know, normally occurs in animals, particularly birds. This on the World Health Organization charts is number 1 or number 2 in their stages. When it rises to human contact and spread, we get the increase that we have seen earlier this week when the WHO raised their warning level to what you see here indicated as 4. They are moving to stage 5 because this is going on throughout the world. But outside of Mexico, and the 1 or 2 people who have come to the United States from Mexico, no one has died yet. Here's the puzzle. Scientists work slowly. People who are in the communication profession, business, need to get the word out. Fear spreads rapidly, especially fear of a disease. Facts and information kill fear. Yes, the WHO has been a little behind the ball, behind the Centers for Disease Control in the United States in getting the information out and doing the tough epidemiological work. WHO has 8,000 people working for it and covers 150 countries. That's not a lot of personnel. Across the globe, we will watch the spread of the disease and see how various countries handle this public health crisis. This is a test of the World Health Organization. This is a test of information systems, and it is a comparative test of healthcare systems and how much individuals across the globes trust their governments to tell them the truth in a timely fashion. We will watch this and watch what the United Nations does to protect its own building here in New York as the influenza spreads among children throughout this city and into counties surrounding New York. On a comparative basis, the Mexican influenza, the swine flu pandemic, is an interesting and somewhat frightening phenomenon. We will continue to watch it and try to bring you accurate and timely information. For ICASTnews.com, live and direct from the United Nations, I'm Jonathan Sanders.